what are maybe some of the top things a person who's considering implants should know or ask about their implant provider before choosing their implant provider?
The number one question is, how many have you done? Right? Because that will give you a feel of if this is the right person. That's the thing I tell my patients, right? They're like, hey, I want to get a second opinion. Okay, when you go for that second opinion, one thing that you want to ask is, how many have you done? And can you handle a complication that may arise from this procedure?
I think that's an interesting question. Can you handle
it, right? And if they can't provide you with, I've done enough, how many is enough? I don't know, right?
How long is a piece of string, right? There's a lot of answers to that.
It's kind of like my son, if I'm sending my son for any type of procedure, the name on the wall is one thing, but I want to know I want to be confident in you. So how many have you done?
What would be maybe a suggestion for somebody to go somebody else? If a person hasn't done, how many implants would you?
That's a good question, right? It's very.
I didn't mean to box you into the corner on that one.
I mean, how many is enough? I'm not sure. Most people will say in all on the full world, until you've done 1,000, you don't really know, right? So it's very difficult because you haven't seen it all. So 1,000 cases is a lot, right? Which means you're doing 2 to 3 cases almost every day, sometimes 4 cases in a day, right? For the entire year, you're just hyper-focused on that procedure, right? And so you become almost like a marksman for that, right? And so
total specialist.
Yeah, so I would say 1,000, right? How many have you done? And that's
a great question.
That's what I would say.
What else should I ask, an implant provider before I choose the implant provider?
Failure rate. Right?
Oh, interesting.
It's a good question to ask.
How would I ask that question?
How often how long do they last? How predictable are these implants, right? What system do you use to place these implants? Right?
And what answers would I be looking for, and what answers would I be maybe alarmed
by? Good question. The failure rate of implants is less than 2%.
Less than 2%?
Yeah, that's based on literature. So if we do this 100 times, possibly twice, you'll be having an issue with an implant. The next thing is, are you using technology to place these implants?
Yeah, what does that mean?
That means imaging, that means software, apps. Apps allow us to, call an Uber, call a Lyft, find food, right? Find the nearest gas station, right? We have so much at our use with an iPhone, right? Because technology has made it easier for us to do what we do in life.
Sure.
Right?
How does that relate to
Same
implant?
thing in implant dentistry. Technology has improved to the point where it makes things a lot more predictable and precise of where I'm placing the implant, right? I know this is where this implant is going to be without any shadow of doubt. And it gives the restorative team the ability to know as well. So we're working collaboratively, right?
Okay.
Which means that my expert who is restoring the implants doesn't have to guess where this implant is.
Okay.
We don't have to guess because we know, we can see this.
So that's a great point, doctor. So technology. So if I ask an implant provider and they give me an answer, what would be a good answer? One that I would hope for, and maybe an answer that maybe I should be concerned about?
What you hope for is a provider is utilizing his CT imaging machine. He's utilizing intraoral scanners. That information is put into a software where we can recreate what's going on inside of your mouth. And
kind of like a 3D simulation of,
it's almost like an exact simulation of what's going to be inside your mouth.
Wow.
And we utilize that information to predictably place the implants where they'll have the best prognosis for success. So for a patient, I would most likely want to know if that technology is being used, whether they're using scanners, whether they're using 3D imaging, whether they're using the implant companies as well, because they provide tools because we're utilizing their components. And so all of this technology works hand in hand. So we're using scanners, we're using imaging. We also show patients in real time what's going on. And so before we do any surgery, we kind of give them an idea of where these implants are going to be and why.
Is there any other question that I, as a patient, again, if I can't choose your practice because I'm in a different state or whatever. Any other thing I should be asking an implant provider to see if that person is really for me or not?
Testimonies, before and after photos, being able to talk to real live patients.
To really prove, in fact, that they get that result. And
Absolutely, absolutely. You would want to know maybe 2 or 3 of those patients, getting on the phone and having a conversation with them and seeing exactly what they enjoyed about the entire process. And also looking at testimonies, looking at before and after photos. That's going to give you a glimpse of what you should expect as well.